Good afternoon all. My topic of presentation is central corneal thickness in myopic children and young adult, a hospital-based cross-sectional study. Coming to introduction, cornea is a principal refractive surface. Normal corneal thickness at the center is 0.52 mm. It ranges from 0.49 to 0.56 mm. Myopia is the most common refractive error. Ocular rigidity is said to play an important role in the pathogenesis of myopia. Cornea and sclera together forms the outer fibrous tunic of the eye and withstand both internal and external forces to maintain eyeball shape. Whether a change in the biomechanical properties leads to axial length elongation and anterior chamber deepening, which subsequently result in decreased scleral or corneal thickness and elasticity, remains controversial. So there are various studies comparing myopia and central corneal thickness, and different studies shows different results. Some studies shows that it has a thicker CCT in myopia patients, some shows that there is a thinner CCT in myopia patients, and yet another study shows that there is no correlation between myopia and central corneal thickness. And also, CCT is an important measure for selecting various refractive surgeries. So, we embarked on this study to establish whether there is any association between myopia and CCT in our region. So, the primary objective was to determine the central corneal thickness among myopic children and young adults attending the ophthalmology OPD in Government Medical College, Thrissur. And the secondary objective is to compare the central corneal thickness among various degrees of myopia and to study the association of CCT with the age and gender of the participants. And coming to materials and methods, study design, it was a hospital-based cross-sectional study. The study setting is in the Department of Ophthalmology, Government Medical College, Thrissur. Study period, the study was conducted over a period of 1 year, and the study population was children from 8 years and young adults up to 35 years attending the ophthalmology OPD during the study period with a diagnosis of myopia were approached for the study. And our inclusion criteria was children from 8 years and adult up to 35 years and those who give consent. Exclusion criteria was astigmatism of more than 1.5 diopter, ocular trauma, ocular surgery, and ocular infections. Sample size calculation was done based on the study conducted by Soluti et al. And it was found to be 126. And the sampling technique was consecutive sampling, and the study instruments were retinoscope, anterior segment OCT for central corneal thickness measurement. And the study procedure was all the subjects underwent slit lamp examination. Those with the corneal scar, corneal edema, keratitis, and other ocular infections ruled out. Study analysis. Data entered using MS Excel, analyzed using IBM SPSS 26 version software, quantitative data measured using mean and standard deviation, and the student t-test used for quantitative analysis, and p-value of less than 0.05 was taken as statistical significance. And qualitative data was analyzed using chi-square test, and correlation between CCT and other variables assessed using Pearson correlation. Coming to results, a total of 126 cases were included in our study, and out of which 48 were males and 78 were females. And our mean CCT was 542.5 plus or minus 14.2 micrometer, and in mild, moderate and severe myopia, mean CCTs were 544, 542 and 537 micrometer respectively, and with a p-value of 0.3, which suggests that there was no statistically significant difference between the central corneal thickness in various degrees of myopia in our study. And also comparing CCT versus gender, in males it was 541 and in females it was 542 micrometer, and the p-value was 1.16, and it also suggests that there was no statistically significant difference in the CCT between males and females in our study. And also compared CCT versus age, and it also shows that there was no significant difference in the CCT between various age group in our study. Coming to discussion, in our study the mean CCT was 542 plus or minus 14.2 micrometer, and similar study conducted by Galappa, Divya K, Ganesh MR in South India, SB Pham et al. And SW Chang also got similar mean CCT values. Comparing CCT versus gender, in our study, we found that there was no statistically significant difference, and similar study done by Hussainad also shows no statistically significant difference. But a study done by Kim et al. In China, they found that there is a higher CCT in men than in women with a significant p-value of 0.003. And comparing CCT with the severity of the myopia, in our study, there was no statistically significant relation between CCT and severity of the myopia. But also, a study conducted by Lalit Sundaram and HB Pham et al. Also shows that there is no statistically significant relation. And comparing CCT versus age, in our study, it was no statistically significant, and similar study done by Chen et al. Also shows no statistical significant relation. And coming to the conclusion, the study demonstrated that the mean central corneal thickness in myopic children and young adult was 542 plus or minus 14.2 micrometer in our region. And the study concluded that there was no statistically significant difference between the CCT and severity of the myopia. It thus shows that there is no significant thinning of myopic cornea in a similar way to sclera during myopic progression. And there was no statistically significant difference in CCT between different age group, gender, and it does not show any correlation with the patient's age, gender, and severity of the myopia. And the limitation of our study was, this study was conducted in a single hospital, and study with a more sample size is needed to confirm the findings. Thank you. It shows that there is no significant thinning of the cornea like sclera in myopia from my study.
Thank you.